Welcome to episode 2 of A Swell Diagnosis, a podcast about lymphedema with Dr. Debbie and myself, Robbie Blackwell. In this episode, we will be focusing on a number of different questions, the first of which is how do we manage this condition, lymphedema?
We talked all about what it was and why, so I guess now understanding what actually is, like we talk about it as best practice, like what's, the best practice treatments. I think there's a lot of information out there and it can be really confusing as to what all the right different, the treatments might be. And I think as we go, we'll sort of give some tips on how to work out where it's the right place to get treatment. But I guess the types of main strategies that we look at is to actually move the fluid out of a leg. We need to look at how we compress and move that, and also how we use the body's natural pump of exercise, and then looking at things like massage. We hear a lot about that. And then lastly, concentrating on taking care of the skin, which is just so important. And I think people miss that.
That's right. It's a really critical part of managing this condition, is taking good care of our skin. We'll also talk in this episode about why is it so important to manage any sort of long-term chronic swelling, whether it's the lymphedema, where it's our plug hole, bringing the old analogy in, where our plug hole and our drainage system's not working properly, or whether it's a chronic edema where we just have a lot of fluid leaking into the tissue from the leaky spout.
So I guess, Robbie, what would be the most effective bang for buck way of managing swelling?
Yeah, look, Debs, it's a really good question. And when I talk to my patients about best practice management of chronic edemas, certainly the first tool that comes to mind is compression. Compression looks like a lot of different things to a lot of different people. And I guess today one of the things we want to do is give an overview of the different types of compression and where the different sorts of compression may be appropriate for different presentations of swelling. Compression, certainly, of our 4 main strategies of compression, exercise, manual lymphatic drainage, and skincare. Compression really is the, it's the mainstay. It's the one that we really, really want to get right, and why it's so important to have a good relationship with a therapist who's trained in prescription of appropriate compression garments to manage different types of swelling.
And I mean, I just taking it back to basics. I mean, when, if someone sprains their ankle, the straight away, the first aid is really, you want to elevate it, you want to ice it, and you want to compress it. You want to put a bit of a bandage on that to stop the swelling blowing out. So it's not like it's a foreign concept.
No, it's not. And I think a lot of people tend to think as soon as you mention the word compression to them, their minds jump to those awful white TED stockings. Now, I know they have their place. I absolutely know they have their place, but I think people think you're going to put them in compression and they think that's what they're going to have to wear.
So true.
And in so many instances, the fit of those white compression stockings is not appropriate and actually potentially can do more harm than good, especially where you've got a leg that doesn't look like an air hostess's leg.
Yes, that's very, very accurate.
So in terms of how we structure therapy for people with lymphedema and chronic edemas, you may have heard of people having bandaging, and that's certainly a form of compression. Do all people go through bandaging programs? Well, no, not all people really need to, but I guess the place of a bandaging program would be if the amount of fluid, possibly indicated by the depth of the pitting in the limb, where there's a lot of fluid, we can put a patient into a pair of compression stockings that may stop the swelling from getting any worse, but it may not help.
It's more like a holding.
Absolutely. Yeah. So the ideal scenario is that we maximize the size and shape of the leg before we prescribe compression. And a really good tool to try to quickly and effectively decongest the leg or get as much fluid out of the leg as you can is to use compression bandages for a short and intensive period of time to maximize the size and shape of the limb before transitioning the patient into a good compression garment that's appropriate size, an appropriate fabric, and appropriate class.
Exactly, all important things, and that's where we, there's no one size fits all.
That's right.
But it's really interesting when you talk about this bandaging as a way to get someone into the holding. It's almost like by doing that bandaging every day, preferably, or every couple of days.
Mm-hmm.
Each time you take it off, it's like, oh, it's left indent. It's like pushed a bit of fluid out. And then
That's
when you put the
right.
bandages on again, it's a little bit, it's now like a little bit smaller, and then each time you're incrementally bringing it down. Like, it's not like it's getting tighter and tighter each time. It's just that it's squeezed out fluid.
More and more fluid.
And I mean, it's just it's actually a really rewarding experience. I'm not going to lie.
It is. And it's, it's something that we regularly recommend. However, I would never put a patient through a bandaging program unless at the end of that program I had the intention of prescribing a compression garment that the patient can then use as one of the tools in their home toolkit to maintain the gains that you've made in the decongestive program. And the ultimate aim is to get fluid out of the legs and to keep fluid out of the legs, to ensure that we're maximising the health of the tissue within the leg.
Yeah.
So certainly compression is a really important part of our management of lymphedema. But as you've said, it doesn't look like the same thing to everybody. There are compression stockings, different knee highs, thigh highs, different styles of compression stockings. But we've also got things called compression wraps that are sort of Velcro bandaging systems that almost
change the world.
Yeah, they almost mimic bandaging, but can be put on and taken off by the patient themselves. And a lot of people find that they're an easier way to manage lower limb swelling than
I must admit, I really quite like them in the context of wounds, because I find when someone's got a bandage on, trying to pull a stocking over the top of it, it ends up rolling up the tape and the band, and it all gets.
That's right.
Then you've got to start again. So I find with the wraps, it's actually a good way because it can help the bandage stay the wound bandage to stay in place,
Absolutely.
and it's and also getting out the swelling at the same time. So winner. So, I mean, just to zone in on something you said before, we were talking about the different phases. It's almost like, do we call it a phase 1 and a phase 2, or do we call it like acute management and chronic management, like short-term, long-term?
That's a great question. So it's referred to often as phase 1 and phase 2, or another way of thinking about it is phase 1 is an intensive phase where we're really working hard using compression and massage and other techniques to get as much fluid out of the limb as quickly as we can. And phase 2 we then often call the maintenance phase, which is where we really try and empower our patients to take control of their own swelling and use the tools that they have in their toolkit to respond to what their body's telling them in terms of what they need specifically to do to manage. And so going back to compression, we often think of compression a little bit like medication in that everybody has their own optimal dosage.
Yep.
So dosage can look like, change in dosage can look like maybe one fabric might be slightly stiffer or stronger than another. But another thing that you can do to change dosage is how many hours in the day does your body need you to be in these compression garments to keep your swelling under control. And often with legs, it's a case of starting with the hours in the day when you're upright, because reflecting back on our first episode, we talked about the effects of gravity on leg swelling. And so generally being in an upright position is when you need to be helping the legs,
have that extra backup support. And I guess that's often one of the questions as I get, just generally not even related to lymphedema, is about flight socks, with people going on a plane and saying, okay, what is the level of compression that you might do, because you're sitting with your legs down and for an extended period, and so having those stockings to prevent the swelling but also prevent getting blood clots and things. So
that's right.
Looking at that, and I often people get a bit thrown by all these numbers and mmHg, the millimeters of mercury and things like that. And so I quite like in lymphedema we talk about levels and classes and things like that, and it's a better way of breaking it down. But again, discussing that with your therapist to work out what's right for you.
Exactly.
But there's this understanding that there is sort of like level 1 all the way through to 4. And so, the way someone might feel or tolerate each level of compression is going to be very different. And
that's right.
So individual to your condition.
That's it. And without going into too much detail, I guess when we, going back to our analogy of the bathtub, if we have swelling in our legs because our lymphatic drainage is impaired in some way, it generally will necessitate a heavier class and fabric in order to control the swelling. And that's why flight socks, even though they're a light, stretchy sort of a fabric, they often are quite effective, because usually when you're flying, it's more of a fluid into the bath issue, and a light compression is enough to keep that under
the
control.
Assumption is the person's plug hole is working.
So we've just got to give it a little bit of a squeeze.
Yeah, I like
that's
it.
Right. All right, so moving on to exercise. So exercise.
I got that one. I'll take that one. I love a bit of exercise, and that's kind of the natural body's pump. I feel like when I think about what's happening in the body with arteries, veins, and lymphatics, and then I bring in and say, okay, well, where are the muscles? The lymphatics are, they're all running between muscles. And so if you're actually looking at the muscles pressing up against the bone, by actually exercising, you're pumping those lymphatics, and it's almost like a caterpillar effect moving the fluid along.
That's right.
And so when we, are sitting still on a plane with our legs sitting down, if we were to get up and walk backwards and forward and do some exercise, we would be shifting that fluid. And so I think that's just so important in the treatment of lymphedema. And I think it's really, really sad in the history, because we often used to tell people, no, don't exercise too much. You'll make it swell more. Whereas now we know so much more, and we know it's in fact the exact opposite.
That's right. That any exercise is good exercise.
Exactly. And I mean, look, at the end of the day, you've got to look at the individual. And if someone, I know that for me, jumping up and down is probably not as good as going for like a brisk walk. But that's what I work out for myself. That's right. Really important that you test the boundaries and understand how your body responds. Mm-hmm. But I sort of, we've obviously stuck with analogies, and let's bring in another one. But let's talk about running for a bus. That's a classic one, right? You run for a bus, your muscles are pumping, they need oxygen and nutrients so that you can make the bus on time, and your fluid rushes in to deliver all those oxygen and nutrients. And then you get on the bus, made it, sit down with your legs dangling, then what happens? You're not moving anymore.
They fill up with fluid.
They fill up with fluids. All that fluids that's rushed in, it's still, I mean, the muscles are now recovering, aren't they? They're now kind of, doing their little wind down, and you've just got all that fluid sitting there. So if you actually did a cool down afterwards, like if I sat on the bus or sort of stood up and just kind of moved my legs backwards and forwards and kind of did a bit of stretches and got my calf compresses
working,
that would actually pump that fluid out. So I think that's what's the most important thing to understand about exercise is cooling down afterwards and still keeping that movement happening, that flow.
Right. And so I guess that's the thing with wearing compression on the outside of your limb, and you've got your muscle on the inside of your limb pushing out, and they're almost pushing against each other. Your lymphatics are between those two forces, and so they will be getting
nowhere to go but up. And
exactly.
Yeah, that's so true.
Right. And the lymphatics don't have their own pump like the circulatory system has the heart. The lymphatics rely on movement largely. To propel the fluid in the right direction.
I think under the category of exercise, I'd like to insert here swimming, because in Australia, we're obviously huge fans of getting in water whenever we can. And the benefit of, for example, just walking in a swimming pool, like as simple as that, by standing in water, the deeper you go, the more pressure there is. That's so if I'm just standing in a swimming pool, there's automatically more pressure at my toes than there is at my hip, which naturally pushes the fluid upstream. Yeah. So then I walk in the water, I've got my exercise pumping, I've got my pressure gradient from the water in the pool, and then I've also got the cooling, rippling effect massaging the outside of my limb.
That's right. Walking in water is a beautiful thing.
Love it.
For swollen legs.
Yes.
All right, let's move on and talk about manual lymphatic drainage massage as another tool for controlling and helping to keep swelling under control. So manual lymphatic drainage massage is a manual technique that therapists and, well, anybody really can use and the aim of our manual lymphatic drainage is to help facilitate the movement of fluid from the limb back to the root of the limb, where it finds the lymph nodes to travel through on its way back to the heart. So
like connecting that pathway, really.
Yeah, that's right. So there are many different schools of thought on manual lymphatic drainage, and we've actually at Macquarie learned an awful lot about viable drainage pathways. We used to once believe that if someone had lymph nodes taken from under the arm, that we should avoid that area. And what we've found is that actually 75% of people after lymph node clearance continue to drain to something under that arm. So it's important to sort of not discount that. But really, again, it's linking in with a therapist who's up to date with the latest in evidence and learning strategies from your therapist on how you may be able to massage your own limb to help facilitate the fluid movement out. But MLD on its own, I would rarely recommend MLD as a standalone treatment for swelling, but really works well as an adjunct to regular use of a compression.
And I think it's also important to highlight that learning manual lymphatic drainage from a therapist that understands lymphedema and where the changes are to the lymphatic system, as opposed to someone who's trained in normal lymphatics and perhaps the beautician sort of red drainage pathways where there haven't been an interruption. It's just careful to look at that distinction and make sure that you're getting the right person for you.
That's right. And really, I guess the proof is in the pudding, isn't it? So if you're having manual lymphatic drainage and you're investing the time and potentially money in having those sorts of massages, you do actually want to see that it's having a benefit there's benefit to you in doing that. And if there's not, then it may be as simple as changing the speed or the pressure of your massage to get a better outcome. But certainly it's worth asking the question if you're not seeing results, because in a lymphodematous limb, after 15, 20 minutes of manual lymphatic drainage, effective manual lymphatic drainage, you really should start to notice a difference, even if it's just softening of the limb. Yeah. So that's an important part of our treatment. That's where compression pumps, sequential intermittent compression pumps come into play, and they can be used almost in place of manual lymphatic drainage. The idea of these pumps is that they mimic the effects that manual lymphatic drainage gives, and helps to sequentially shunt fluid up the limb towards the lymph nodes.
So it's sort of, and I think the interesting thing about these pumps is, because I know in the past they necessarily weren't sequential, and that was part of the problem. It was sending fluid the wrong way. But now that we know is so much more, and we look at sequential, we're actually people think, well, if I start at my fingers and push all the way up to my upper arm, or I start at my toes and push all the way up, that's how it's done. But actually you need to clear the traffic jam. You need to clear the top pass first. And that's what's wonderful about these pumps. They actually do it in a specific order, so that we're actually clearing the way, so that we can then shift it from the toes all the way up. From the more
distal part,
Exactly.
Yeah. What about skincare, Deb? Do you have any particular advice you give to people in terms of taking care of their skin?
Moisture. No one wants to say that 3 times. I think it's just so important, because the actual integrity of the skin is reliant on that. Like that's our defense mechanism. That's how we protect ourselves. We're all covered in bacteria. As I'm a once a day shower, I'll say that, but I'm going to have bacteria there. That's what's natural to be on my skin. What's a problem is when I've got a break in my skin, and then that first line of defense is damaged, and the bacteria can go in. Exactly. Yeah. And so when you've got someone with dry skin, we've all seen, where you get that dry skin, you can always see it's almost like having a desert cracking, and you sort of think, oh gosh, it's like you can see the little gaps there. And so the slightest dryness actually creates that microscopically. And so you may not even actually cut or damage in the garden or anything like that. It's just straight up, the dryness is one of those things. And even just, when you look to people they get cracked heels, and you say, okay, this is definitely an entry point here, especially feet when we're walking around on things that aren't necessarily clean. So definitely taking care of that skin, and having a good sort of barrier that keeps the skin soft and firm, and certainly not breaking down. And I people ask me all the time, what ingredients in moisturizers? How do I choose a good moisturizer? And at the end of the day, I think what's important is how thick the moisturizer is, and that it's actually absorbing into the skin. And I often say, choose something that comes in a tube or a tub, because if it comes in a pump, it's probably got too much liquid in it that it's got to get up through the pump, and therefore it sort of evaporates more easily. And people say to me, yeah, but I want moisture. Isn't that the whole point? And it's like, no, actually, this is about putting a layer on that seals it in. And it's that
thicker moisturizers, you can feel.
It's almost like the ointments. It's almost like, oh gosh, that's hard work to put on, but then you can see actually, and it does sort of soak in. And if I go back to that desert analogy, when you've got that really dry, hard ground and it's cracking, and you try pour water on it, it's just going to roll off, and it's just not going to do anything. Whereas if you give it a slow, good soak, and then the soil, improves and it becomes healthier again, the next time you pour water on it, it'll just soak it up nicely and be all really happy and healthy. And so the better you moisturize, the more easily it is then that your body will be able to soak that up, and that the actual surface of the skin is healthier. And when we look at the really tiny part of the lymphatics, they all run in the surface of the skin. So if you've got a healthier sort of that surface layer of skin, you're going to have better working lymphatics, and they'll respond better to the massage, they'll respond better to the compression, everything.
So compression, exercise, manual lymphatic drainage, skincare, they're really the four main strategies that we use. It looks like different things to different people depending on the stage and severity of their lymphedema, but ultimately most patients will end up with their own set of tools in what we like to think of as a toolkit. I guess the other advice is the importance of linking in with a professional that can help you to understand when and how to use the tools in your toolkit, but to equip you with the confidence that this is your body, and ultimately you've got to be involved in coming up with a regimen of care that works for you and your body.
100%. And I think, I guess the next part here is just the why. Why do we need to do it? Like, you know, many people will say, well, let's just, you know,
my limbs are swollen. I've just got swollen limbs.
Yeah,
that's just how it is.
That's just it is.
Yeah.
But I think, you know, one of the biggest things is that risk of progression of disease and infection.
Absolutely.
And
skin breakdown and potentially then wounds and trauma.
Exactly. And I think when you go right back to the beginning, we were talking about what is in lymphatic fluid. It's protein. And that really is I guess that protein is almost a yummy snack for bacteria. And so the more of that that's built up, it's that infection will actually have a bit of a party there. And because the lymphatics aren't working properly, they're not draining away
and clearing
they're not clearing, and the actual white cells in the body that fight the infection aren't able to work optimally because the whole system's not flushing properly.
That's right. And we do see in people with chronic swelling a much higher incidence of infections like cellulitis. So definitely more prone to those infections. And then once you get the infection, that then has a negative effect on the lymphatics themselves. So you're setting up this nasty, vicious cycle.
And so certainly, obviously, as a doctor, I'm often involved in prescribing of antibiotics to treat these infections. And you know, I won't spend time going through the details of that, obviously, you know, speaking with your doctor about that. But certainly in lymphedema, we do notice that the infections like cellulitis tend to last for longer and often require more antibiotics, longer courses of antibiotics, rather than just using a week. It might need to actually be 2 or 3 weeks sometimes. And again, everyone's an individual and we look at each scenario, but certainly that's something to review and take into consideration.
Absolutely.
And the other types of infections that don't require antibiotics but actually require antifungals, like when you think about infections of tinea, particularly looking at between the toes, and especially when people have swelling, they find it difficult, like to dry between the toes. Because I mean, let's face it, if you've got a little swelling in the toes, it's difficult to get between. And
I find it difficult to dry between the toes.
But that's just so important, because that's an area where you then can get the skin can break down, and that can be an entry point for the bacteria as well. So really important.
So minimizing risk of infection is one really critical
100%.
Component. Minimizing progression of the disease itself is also really important. So in a limb that has a chronic edema, we get these secondary changes to the skin and to the tissue health, which over time can lead to things like skin fibrosis.
So it's sort of this thickening of the skin. It's almost like this really indurated kind of area. And you can even get bubbling of the skin, and it almost looks like sort of, I mean, that sort of toughening of the skin sometimes can look a little bit like, I guess, elephant skin for lack of better scenario. But it's certainly that change it is possible to reverse it, but it certainly is much more difficult at that stage. And the other part that people sometimes see is these little blisters appearing, or lymphoceles, and that's where we can get fluid leaking
starts
from it.
To leak, and then that starts to further break down the skin. So really, I guess the earlier we intervene to maximise tissue health and minimise the progression of disease and skin breakdown, the better the long-term outcome by far.
100%.
Yeah. And then there's all those comfort benefits, psychological benefits, financial benefits of not then living with this chronic condition.
Exactly, yeah. And we certainly do see when we survey people that definitely these qualities of life really
absolutely
can be so dramatically affected.
Major impacts, yeah. So, Debs, where can our listeners go to get help?
Yeah. So certainly, obviously, we're speaking mostly to a UK audience, and really, there's the British Lymphology Society has a good directory. So if you sort of go to thebls.com/directories, and another option is to actually email Lymphoedema. .org, and that's the Lymphoedema support network, and sometimes they can point you in the direction of a local area, but here's a good way to get access to a therapist. At least you know that they're the type of therapist that is used to managing leg swelling or limb swelling, or any swelling really, and that's really important to get that qualified person. So just one more time, thebls.com/directories, and I guess we'll probably get that put in the description below.
Why not?
Why not? Someone will do that for us.
Yeah. So look, thanks all for joining in. We hope you've enjoyed the 2 podcasts on what is lymphedema and how to manage it and why you should manage it. And we wish you all the very best with your legs and your leg health.
Thanks for having me.